Andrea and Tasso, thank you for your time. We spent the last few weeks studying your QM manual in detail, all of it in German, and working closely with Tasso to understand how your 5 houses operate day to day. A few things stood out to us. Your caretakers are doing excellent work, no doubt, but a lot of their shift time goes into manual documentation. Every visit, every meal, every medication has to be recorded by hand. That time could go back to the guests. On the billing side, we see an opportunity to tighten the loop, especially with short term care guests, where there can be a gap between care delivery and invoicing. Even a small delay there can mean lost revenue over time. When it comes to complaints from families to insurance providers, having the right documentation ready quickly makes all the difference. We want to make sure your team can pull up evidence in seconds, not hours. And we noticed something important. Your caretaker team is diverse, with staff speaking Turkish, Arabic, and other languages. But official documentation needs to be in German. We thought, what if AI could bridge that gap automatically? We took all of this and we didn't build a presentation. We built a working system. What you are about to see are fully functional prototypes, not concepts, not future plans. Let me show you one day at DRK, Oberhausen, the way it could work starting tomorrow. QM manual is over 1000 pages of German documentation. No one has time to read it all, and for caretakers who speak Arabic or Turkish, it's practically inaccessible. We have built an AI assistant that has ingested the entire QM manual and can answer any question instantly by voice or text in German, English, Arabic, and Turkish, always citing the exact source document. In this demo, you will see an admin ask in English about MDK audit requirements and get an accurate answer pulled directly from the QM manual in seconds. No searching, no guessing. I put the question, what documents and records do we need to have ready for an MDK quality audit? Let's see what it responds. It comes with an animation which feels like a real person is talking to these people. So it gives an answer, a comprehensive answer about MDK quality audit, and along with the answer it also gives the sources from which documents it has pulled this information from. Now this can be used by anyone, caretaker, admin, or staff manager, and it can respond in any language. Just like English, you can choose Arabic and then you can ask anything on Arabic. Let's see what it gives. It gives answer in Arabic at the bottom, the sources by which it has fetched the information from. Every time a caretaker visits a guest, washing, feeding, medicating, changing beds, they manually write it down in Excel sheets or paper forms. This eats 30 plus minutes per shift and the documentation is often incomplete. For caretakers who speak Arabic or Turkish, writing accurate reports in German is even harder. We built a mobile AI agent that lets caretakers document care, simply taps or by speaking in their own language. The AI structures everything, timestamps it, and generates the official report in German automatically. So in this particular case, I'm going to show you where this caretaker is logging the events for this resident. So what she can do, either she can click on these things and mark these things as done, or else she can just click on this thing, medicine done, food done, bathe done, wash done, grooming is also done, bed is done. Wait, food is actually not done because I tried to give the food but the resident refused to take it, and she can finish recording and put the logs. She can also see the history, she can see the reports, and she can download the report for a particular shift, which is in German. A particular caretaker is also provided with a dashboard where he or she can view the daily task, the assigned task, the control shift engine, everything about the residents. She can click and view the task. She can clock in and clock out. She can also see the ratings of hers, tasks that she has performed, on time, quality, everything she can see on a dashboard. Billing at Red Cross is entirely manual. Care is delivered, but invoices don't go out on time, especially with short-term guests who leave the house before billing is even informed. That's the revenue lost every day. We built a system that auto-generates billing the moment a caretaker documents care. No manual entry by billing staff. When a guest is discharged, billing is triggered instantly. So this is how it looks like on the admin dashboard, where on clicking on dashboard, he can see the overall view of the financials, house-wise, 7-day trailing, month to date, total booked. You can click on registry and see each billing entries. You can click on resident details and click on any resident to see their billing details. You can click on invoices and download an invoice PDF. When a complaint comes in from a family member, an insurance company, or even a prosecutor's office, the admin team has to dig through paper files and Excel sheets to find proof of what care was actually provided. That takes hours, and sometimes the proof simply doesn't exist because documentation was incomplete. We have built an AI agent that pulls up all care evidence for any guest on any date in seconds, timestamps, caretaker names, and activities performed, and compares it against the QM manual and compares it against the QM protocol to give an instant compliance assessment. In this demo, you will see a real scenario. So this is the past complaint that I've opened. So what our AI agent does, it compares the allegation for a particular resident on a particular day and does the deep analysis where it figures out, it digs deep and gets all the logged information which was made by the caretaker and also compares with the QM manual. So in this case, it says that it is non-compliant since medicine was not given, and this was the complaint which was raised. So final verdict says it is non-compliant. Now let me show you and log one real incident. Suppose now we have got a new complaint where for this particular resident on this day we have got a complaint where the family member is saying that food is not given. Let's see what AI insights information our AI brings in and what final verdict it gives. So these are the information which it brought, and it says yes, food was not given based on the logs which was recorded by the caretaker. It gives the complete deterministic answer why it is not compliant, why that complaint is a valid complaint. It has full proof about everything. So here you can see the compliance assessment and also the QM protocol summary. On clicking on this button, you will see the complete detailed report. It is basically an evidence report that you can see. Today, Andrea has no single screen showing what's happening across all 5 houses. Occupancy, billing, complaints, staffing are all tracked separately, if at all. And when it's time to negotiate care rates with AOK, Red Cross has no hard data on actual cost per guest. We built a CEO dashboard that aggregates everything in real time and a negotiation intelligence module that calculates actual care cost from caretaker logs so Red Cross can negotiate rates with real numbers, not estimates. In this demo, you will see Andrea's view of all 5 houses in one screen and a cost analysis showing exactly where reimbursement rates fall short. So this is the overall view of the dashboard where she can see assigned tasks, completed, efficiency, care quality, all the residents living, all staff available, all the finished tasks. She can see the activity, task completed per day, care quality, health. She can also see all the caretakers involved. She can view the profile of theirs. She can add a caretaker. She can also remove the caretaker. She can click on residents to see any residents she wants, everything about any resident. She can also see the complaints. This module we have already seen. And most importantly, she can see the operations which are happening. Executive Control Center for monitoring facilities, staff deployment and financials. This is the operations map. Residents, caretakers, today's revenue and managed facilities. Each house is everything at a glance. She can click on a house and know all the details corresponding to that particular house. The actions required, attention required, everything at a glance. She can click on financials and see what is happening across houses. And each and every information present in the dashboard is being reflected in real time. The caretakers taking care of the residents, putting the logs, the billing data, everything populated instantaneously in real time. And Andrea can have an overall view in real time about each and every activity in one single screen. New employee onboarding agent. When a new caretaker joins Red Cross, especially one who speaks Arabic or Turkish, they are expected to learn care protocols from 1,000+ page German QM manual. That's unrealistic. Training takes weeks. And even then, important protocols get missed. We build an AI onboarding assistant that walks new employees through everything they need to know in their own language. They ask questions, the AI answers from the actual QM manual, step by step. In simple language, in this demo, they ask questions, the AI answers from the actual QM manual, step by step in simple language. In this demo, you will see a new Arabic speaking caretaker ask the AI how to handle her first morning shift and get a clear step-by-step guide instantly in Arabic, sourced directly from Red Cross's own protocols. So this is how the screen looks like. It talks about the critical morning shift, the confirm and continue, then it talks about how to document care activities, then emergency protocols, protocol library, they can just have a look at this one, and at the end, start AI Hub, where they can start asking questions. For example, someone who knows Arabic joins and asks anything in Arabic. He or she can speak just like she wants in her own language. They get the reply in the language that they have selected. So it has responded about the morning shift, and it also mentioned the sources from which it retrieved the information from.